These are the four organisations, the four federations. It's International Diabetes Federation, the Union for International Cancer Control, World Heart Federation, and the International Union Against TB and Lung Disease. We came together as federations because as federations we can work together at the global level but also at the local, national level, which is extremely important. Between us, we have 900 member associations in 170 countries, so we have a lot of people power, and we cover the four main NCDs. Thank you. Basically, what we do, we have become in the last 2 years a leadership vehicle for civil society. We're linking, as I said, the global to the local in terms of advocacy. We provide technical expertise. In many countries, we're actually responsible for the basic health service delivery in aspects of non-communicable diseases, particularly in low-income countries. And we provide a great deal of essential patient support everywhere, even in high-income countries. And I put a sentence there at the end of it that governments actually rely on us. In many countries, there's not a clear dividing line between the people in our organisations and the government. And the people in our member associations work for the government by day and actually volunteer for our organisations in the evening. So this is really where I would like you to see us. We're not just advocacy organisations, we're also delivering care on the ground. Next one, thank you. What are we doing for the summit? We are leading and convening a civil society movement for NCDs. We decided that we would do that because there was a political space and nobody was doing that. Last summer, when the summit was announced, we got together and drafted our own business plan for the summit, which has our objectives in here and our work programme, and I have copies of that. We also got together a disease-specific level. So this is the disease-specific plan that IDF has for diabetes. So each federation is working at two different levels, disease-specific and at NCDs together. We, in the International Diabetes Federation, recently produced the first of our advocacy documents for the summit, which is an international call to action for diabetes. We will be following this shortly by the first ever global plan for diabetes and a charter of rights for people with diabetes. These are just some of the things that we're doing. Along the bottom there are examples of events that we have panels, making the case. We're producing policy briefs, articles, getting the evidence together. What you can't see properly, the last document there, is an example of our 3 member associations in America jointly lobbying the US government. And what is happening more and more at national level is that the various federations are working together and have formed sort of national level NCD alliances. We've seen this in Norway, Australia, Uganda. This is happening all over the place, and I want you to know this because this is quite an important change in the landscape. We are very much the global voice of our membership and people with NCDs. We're producing the evidence, as I said, at both levels, NCD and disease specific. We're at the moment working on our own NCD targets and indicators. We have a meeting next week with the Lancet group, and I believe that WHO will be at that meeting. We are doing as much as we possibly can in concert with WHO, because we feel that the worst thing we could possibly do is turn up at the summit in September with 2 different approaches, 2 different global price tags, 2 different sets of numbers. So what we want to do is pull all of this together as much as we possibly can. And we're working with a group of like-minded NGOs, governments and businesses. Thank you. Next one. Just to very briefly look at where we are now, we have a steering group with the 4 founder federations. We are funded and supported by a group of 8 major NGOs. We have a common interest group. We have a telephone call with a common interest group, which now has a monthly telephone call, sorry, which now has 220 NGOs in it. Those are not just NCD-specific NGOs, they're also organisations, development NGOs, health professional associations. There's a very wide range of NGOs that are being attracted into this movement. We have private sector organisations who fund us. So we are funded by NGOs, and we're also funded by the private sector. We have a website which I'm told has had 54,000 hits on it, if that means anything to you. But what we want to do with the website is just to publicise and get out there everything that we've got. And we have some very important allies. WHO I've put as number one, World Economic Forum, Lancet, and like-minded governments, and a whole lot of others. Next one, thank you. We have asked for 6 specific things from the summit. We're asking for governments to be accountable and measured on NCD plans, and we are including in that our full support for the implementation of existing plans, particularly the WHO's global plan on NCDs and all the other plans that governments have already agreed to. Prevention, absolutely critical to everything that we're talking about, risk factors including under and over nutrition. Resources, people have talked about that, that we will need resources to deliver NCD interventions, particularly for essential medicines and technologies, and the essential medicines are not just there for the treatment, they're very important for treatment, but they're also essential to prevention and prevention of some of the secondary and very expensive and serious complications of NCDs. We're looking for globally agreed approaches to NCD treatment and care. We think that at the summit, governments will ask us what some of them are asking us now, which is basically, where do we start? I think we've moved the agenda from saying we have a problem to saying we know how to fix it, but we have to give governments very easy approaches. We have to explain where to start and what it's going to cost. We want the Framework Convention on Tobacco Control to be fully implemented. We would like to see tobacco eliminated tomorrow. And the final demand is really about NCDs as being part of the development agenda, an integral part of what we hope will be the MDG successor goals. In all of this, we're arguing for integration of NCDs into health systems, into existing funds. We're not looking for a new global fund. We're not looking for a new UN agency on NCDs. We want this integrated, and particularly at primary healthcare level. Thank you. Where are we now? I think it's unusual for an NGO to say that we're happy. We're not supposed to say that. We're not supposed to say that. I want to say that we're happy. We put a lot of work into the modalities resolution. Of course, we didn't get everything that we wanted, but we're actually happy with the outcome. And we think that the modalities resolution and the summit format that we've got stands every chance of giving us a strong outcome. We're very much raising awareness and mobilising around the summit and NCDs in general. A very strange thing is happening to me. Ministers and very senior officials are asking me when I'm going to send the invitation to them to come to the summit. 2 weeks ago, a Minister of Health in the Gulf asked me when I was going to send his invitation, and he gave me a particular topic that he wanted to put on the table for the summit and asked me whether I could take it there. And I had to tell him, it's yours, it's not mine. Civil society's on the outside. It's your summit, it's a government summit. And I think this is happening because we've been out there making a lot of noise about that, and there is some confusion out there as to who this summit belongs to, and you guys have to take this back, and you guys have to tell governments that it's theirs. There is a difficulty here because when the minister asked me, well then who do I go to make sure that my issue gets on the table, it's very difficult to actually say who do you go to, so I said the WHO and his ambassador based at the UN in New York. We're engaging very actively with the WHO, UN consultations, and with the Moscow meeting, those are all very important to us. We are lobbying heads of government and state to be present. We will be running some very strong concerted campaigns at national level in order to get the right people there. We need a few heads of state now to come out publicly and say they're going to be there to encourage the others. We're producing, as I said, disease-specific NCD targets and indicators, and we're doing a lot of the technical work now, and a lot of this with WHO on health systems, essential medicines, implementation of FCTC, and really that just very practical guidance on where to start. Next, thank you. What do we need now? We need a high-level focal point within the UN in New York for this summit, as there was for the high-level meeting on AIDS. We're liaising with the Office of the President of the UN General Assembly, but they're very busy. They have to look at the whole year's business. We really need a high-profile person in New York to balance WHO's leadership, but based in Geneva, but that's what we need. We need leadership across the UN system, and I think there's been talk about that today, about how do you pull all of this together. We're looking for a civil society task force to be established under the office of the President of the General Assembly. This is what was done for HIV/AIDS, and for civil society to be included in national delegations. The modalities resolution talks about the mobilization of parliamentarians, and this has to be done. We're looking for somebody to be talking to the private sector, because again the private sector are coming to me and asking me what's going to be their role in the summit, and it's not my job to say, and I don't know the answer. Next one, thank you. What are we missing now? I think we're really missing this safe space for government, NGOs and private sector to be dialoguing. I think we've had some discussions today about some of the big questions. I don't think we want to confuse governments by being too complicated, and so the demands that we go in with have got to be very simple and very specific. But we still can't afford to lose our focus on the big questions: obesity, the globalized lifestyle, the links with the environment, how we're going to fund this, radical thinking, new technology, how we're going to get the health sector workers in there that we need, all of those things. And down there is, what is the post-summit leadership vehicle going to look like that will bring together the various actors that need to take this forward? And I'm saying here, these are generational time horizons. We're interested in a UN Decade of Action on NCDs. Thank you. What we're asking you to do, it's around leadership. It's around persuading the donors and funding organisations to invest. Messaging, we've heard a lot about that. That's very important. Doing what you do best, providing guidance to governments who are looking for the guidance on what to do, encouraging research, promoting the rights of people. And that's it. Thank you very much. Just my last slide is just to say that we're heading for a turning point in 2001, so this is our generation's chance to make a difference. Thank you.